Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, Tom Viola here from Pharmacology Declassified. We got another Fast Facts Pharmacology Edition. Well, if you've been following along with all these Fast Facts Pharmacology Editions, you know we're still talking about pain management and we're still talking about NSAIDs because there's so much to talk about. Well, the next concern with NSAIDs, even though we know and we love them for managing dental pain, because again, we know that all dental pain is acute inflammatory pain. What better drug to treat that pain than a non-steroidal anti-inflammatory drug? Perfect. Well, we also have to be aware of the negative effects of NSAIDs, and we talked last time about ulcerations, but now let's talk about bleeding. We know that NSAIDs reversibly reduce platelet aggregation, so they have an antiplatelet effect. Unlike aspirin, however, the antiplatelet effect of NSAIDs is minimal, and it lasts a lot less time than aspirin's effect is. That's because aspirin irreversibly reduces platelet aggregation, while NSAIDs like ibuprofen only reverse that or reduce that platelet aggregation during the time the drug is actually in your bloodstream. Once the drug leaves, the effect is gone and platelets go back to their normal activity. So because of that, the risk of bleeding with NSAIDs is far less than you would expect with bleeding induced by aspirin. So we know that the effect is lesser, but here's the condition now that needs our further attention. What if the patient already has a tendency to bleed? What if the patient has a bleeding disorder? Or what if the patient is on a medication that can make them bleed? For example, anti-embolic medications like antiplatelet agents and anticoagulants. Well, when I talk about anticoagulants, I like to talk about the old-time favorite drug, Coumadin. Okay, so Coumadin, as you know, interacts with ibuprofen to some extent and increases the risk of bleeding. Coumadin is a highly plasma protein bound drug. When other drugs that are also somewhat highly plasma protein bound are taken along with or concomitantly with Coumadin, that can displace Coumadin from the active sites and actually make Coumadin therefore more effective and therefore lead to potentially more bleeding. So there's an increased risk of hemorrhage. Now, NSAIDs like ibuprofen aren't very highly plasma protein bound, but they're plasma protein bound enough. Not as much as aspirin, but enough that the effect is noticeable. However, we feel that in most cases, unless the medical doctor has an issue with the patient taking ibuprofen with Coumadin, that in enough cases already, the benefit of using the ibuprofen may outweigh the risk associated with using it with Coumadin and increasing bleeding. That is up to the medical doctor to make that decision. Again, I always encourage consults with medical doctors to make sure that we're on the solid ground and we're taking partners whenever necessary, because at the end of the day, we're responsible for the safeguarding of our patients' health and delivering good quality dental care with the least pain possible. So until next time, my friends, when we talk more about NSAIDs, this is Tom Viola, and I'm saying once again, be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.